sanitation can curb the outbreak or prevent future outbreaks. So that's why it's important using every single tool we have to prevent people getting sick.
And are people taking in the education? Are you seeing a difference in behavior?
Yes, people it's concerned, is trying their best, but when you are living in a flooded area, it's very complicated to maintain the level of hygiene required for actually stop an outbreak of these circumstances. So we are all trying our best to protect from the population individually, from the assistance from the MOH and from other partners to improve the living conditions, but it's not an easy task.
All right, we're talking about South Sudan. I wonder if you're concerned about other areas, other regions with the same problem.
Yeah, I mean, we are always alert to outbreaks of hepatitis E. The problem with the outbreak is normally it's very slow onset, so you don't see many cases because, as I said in the beginning, most of the cases are self-limited and they are not severe. So we are monitoring closely jaundice, so when people become yellow and has fever and enlarged liver, mostly in pregnant women. So we have a surveillance system in the programs in areas where the potential risk of outbreaks is there to be alert. And when we have unexplained maternal deaths, we don't miss the first cases, because the sooner you act, the better it is, and the sooner you can control the outbreak.
I mean, it's remarkable that this is a world's first, isn't it, this vaccination campaign that you've embarked on?
Yes, indeed. And that's a successful history of long-lasting efforts on hepatitis E. So we have been monitoring new tools for hepatitis E since years. So when we have a new vaccine, that is a Chinese vaccine that was licensed in China in 2012, we got very excited. In 2015, WHO recommended the vaccine for outbreak response, mostly in pregnant women. And the good collaboration we had with the Ministry of Health of South Sudan, that we have been partners for 20 years, it made this possible. It was a collective effort from the health authorities, from the population, and from MSF to make this happen. And we are quite proud and willing that this is an experience that will have more evidence of the efficacy and safety of the vaccine to be able to be more routinely used in outbreak response.
All right. Well, congratulations on these efforts. And we hope that this serves as a template for other parts of the world in dealing with this. But well done on this, and thank you so much for your time.
Thank you very much for having me.
Thank you. All right, that was Monica Rull, who's Medical Director for Médecins Sans Frontières, Doctors Without Borders, speaking to us from Geneva about this remarkable vaccination program, a world's first to fight hepatitis E. And this was carried out in South Sudan, which has really had a problem with hepatitis C outbreak